Oh, no, you do switch them.
Well, good afternoon to you.
Hello.
So tell us your first name for the record.
My name's Sally.
So Sally, we are in Dr. Newhart's office in Parkersburg, West Virginia. And tell us what brought you to the office today.
I had a little growth on my tongue that was getting to the point it was causing me problems.
Mm-hmm.
And it was to the point it needed to be removed. And Dr. Newhart said he had a procedure that could be used to remove it. So
So you said you'd come on in.
yeah.
So we went and measured it, and it was pretty round. It was about 6 millimeters by 6 millimeters. It looked like a little pencil eraser. That's what it looked like.
Yes.
So I know that when I introduced myself to you, you had a bunch of questions. You wanted to see the laser. You were a little bit nervous about how the procedure was going to go. Maybe you were a lot nervous. I don't know. You tell me.
I was very apprehensive. I'm diabetic.
Mm-hmm.
I had 2 stents, so I have a little bit of a heart condition. I have always been very concerned about my mouth,
Right.
for a lot of different reasons. And I was just very much afraid to have it removed.
So we used the I+ to do it, and we used a chisel tip. We were in and done in, I don't know, maybe a minute, maybe less.
Less than a minute, I'd say.
I know it's not polite to stick your tongue out, but for this, would you show us what we just did? I'm going to come on in and take a look. So stick that tongue all the way out for me. All right, so that's what we just did. And we didn't have any bleeding.
There was no bleeding. I didn't feel it at all, and there's no pain now. And I asked when I would be able to eat, and the answer is as soon
Right
as
away.
I'm comfortable eating,
Yeah.
and as far as I could tell, I have no reason to think I won't be able to eat dinner tonight.
You'll be just fine. It'll feel like a little bruise, right?
Yeah.
Traditionally, would have used the blade, you would have bled, we would have needed sutures, and you would be uncomfortable as it's healing.
Right.
With this, we eliminate all that stuff. If we were to take a look at where that incision point is with the laser 2 days from now, we may not be able to find it.
Right.
You were a great patient, and now that you've had this done, you think you might tell somebody about your experience today?
I'm sure I will, because a lot of the folks that in my age group,
And that's 25 to 29?
Yeah.
Okay, gotcha.
A lot of us are on blood thinners, so we are concerned about bleeding issues.
And you had nothing, and we didn't need to take you off any of your medicines. It's in, out, and done.
Correct.
Feeling good?
I feel great, so I'm very pleased.
I really appreciate your comments.
Okay.
Thank you so much.